looking in the EHR, and I have Janice Jordan. She's a female, date of birth 4/15/47, and she is allergic to latex. In my orders for her today, I have a urine culture and sensitivity test. So I'm gonna obtain a sterile urine specimen from her indwelling urinary catheter. And it looks like that is to be done now. So I will gather my supplies.
Okay.
Okay, afterwards I'm gonna perform pericare. So I'll bring this. Grab a sterile syringe, making sure there's no latex in any of these that I get. Okay. Get a sterile specimen and some alcohol pads and my clamps. Alright, and I should be good.
Okay.
Knock knock.
Hello.
Hi, my name's Lainey, and I'm going to be your student nurse. And hand hygiene, provide privacy. Could you verify for me your name and date of birth?
Yeah, it's Janice Jordan, 4/15/47.
Okay, and Mrs. Jordan, are you allergic to anything?
Yes, latex.
Alright. Do you have any other sensitivities to betadine or adhesives?
No.
Alright. So I am here to get a sterile specimen from your urine. Have you had any pain or discomfort with your catheter?
No.
Okay. It's saying that you possibly have a UTI. Have you ever had a UTI before?
Yeah.
Yeah. Are you experiencing any abdominal pain?
No.
No? Okay. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain you ever had, how would you describe your pain at this moment?
A 3.
Okay.
Some burning.
So this is a completely painless procedure. It'll just take me a moment. So first I'm going to clamp the tube. We'll make sure there's no old urine in it. And after we clamp it, we'll let you be for about 10 to 15 minutes so we can get some fresh urine where I'm going to get the specimen. I'll draw the urine and that'll be it.
Okay.
All right. I'm going to get ready. My sterile specimen. Everything I have is latex free. I'm going to put on some gloves. Should have a trash in here. Is it okay if I expose you a little bit?
Mm-hmm.
All right. I'm just going to keep them as covered as possible. All right, so I'm going to drain all this urine out of here into the tube. And then I'm going to use my clamps to clamp here. All right, so we're just going to leave this for about 10 to 15 minutes. And I will be back to gather the specimen.
Okay.
So it's been about 10 to 15 minutes, and I'm ready to gather. Alright, before I do anything, I'm going to open this, making sure that I keep everything sterile, so that somewhat can't get knocked over. Alright, is it okay if I expose you?
Yes.
After I clean this port, I'll just have you hold as still as possible. That way we don't accidentally recontaminate the port.
Okay.
Okay, I'm gonna clean this. Let that dry for 30 to 60 seconds. Making sure I don't turn my back to the sterile field, so I don't know if it got contaminated. Okay, then I'm going to open my sterile syringe, making sure again it's latex free and it's not expired. Alright, so again, this is a painless procedure. It'll just take me a second. Alright. making sure I don't touch the rim of anything. Dispose of that. Okay. I'm gonna put my client's name and date of birth. Then I'm gonna put today's date and time. And I'm gonna put where I gathered this specimen, which would be a Foley cath, and my initials. Okay, so I have my specimen. I'm just gonna clean up a little bit. And before I unclamp it, I'm just gonna change my gloves. And I'll unclamp that, make sure it's not kinked, and do a little bit of peri-care. Hemostats, make sure that this isn't kinked or it's torn the plastic in any way. Okay, do some peri-care and some cath care. All right, I think that's all we have to do right now. Do you need anything else while I'm in your room with you?
No.
Okay. If you're experiencing any excessive pain or anything, just let us know and we can come in and check your orders to see if you have any medications.
Okay.
And I'll be back in about an hour to check on you. I'll get you comfortable again. Here's your call light. I'm gonna make sure your bed's locked. Are you comfortable sitting up?
Yeah.
Give you back your personal belongings. And just clean up my area. This will go in laundry, wash this, put it away. Take my sterile specimen to turn in. I'm gonna just make sure my hand sanitize before I leave. Open the curtain. All right, thank you.
Thanks.